Now, I want to say that homelessness is a solvable problem. Modern day homelessness as we know it is a solvable problem. It wasn't always this way. Now, those of us who are older remember when we did not have homelessness as we do today. And it was driven most clearly to me about maybe 3 or 4 years ago, where I was representing Care for the Homeless to accept an award from a local, from one of the state assemblymen in Brooklyn. And it turns out it was, I had to get off one subway stop away from where I grew up and where my mom still lives, and I go to see her at least once a week, so I'm familiar with my immediate neighborhood. But I came out of this subway station where I used to ride my bikes. It was at a rundown area, and I stepped out, and I was like, wow. It was built up, it was gentrified, it was great. It was a poor neighborhood, it was a poor neighborhood no more. But as I was coming out of the station, in the station was a homeless man laying down. Now, 30 years ago, we had more poverty in that neighborhood, but we didn't have homelessness as we have it now. There was no one sleeping on the subways in that neighborhood 30 years ago. So homelessness is a preventable problem. One of the major causes of homelessness is the federal government's retreat from affordable housing. In 1977, there was $77 billion allocated for HUD's fight and to promote affordable housing. 5 years later, it was down to $17 billion. It's been cut, and it hasn't gone up. The highest it's gone, with the exception of stimulus dollars, is about $30 billion. We have cut by 2/3 our nation's commitment to affordable housing. At the same time, we see a tremendous increase in homelessness. So, next slide, please. We know that homelessness works. We have many tools. One of them we know is that supportive housing works. This is from the Corporation of Supportive Housing, some of their documentation, where it shows that not only does this supportive housing increase health and health status, but it also is less costly. This is for those who are chronically ill or chronically homeless, we know that supportive housing works. We know that housing first movement works for many people. We know that rent subsidies work for many people. And we see the effect of public policy as a factor in driving homelessness and ending homelessness most clearly right now. In New York City, there are almost 50,000 people sleeping in city shelters on a given night. 18 to 20 months, about 20 months ago, the number was 35,000. What caused this almost 40% increase in 18 months? Well, 18 months ago, we had, not a perfect, but we had a rent subsidy program for those exiting shelter to help them get stabilized in their apartments. We would subsidize their rents for a period of time. Between a fight between the city and the state, the program was eliminated. And we see a huge increase in homelessness, homeless families, homeless individuals. And I want to emphasize, it's an extra 15,000 people who are living in city shelters compared to 18 months ago. But that's just not a number. Those are children. Those are individuals. Those are men. Those are women. We know what homelessness can do. I'm always inspired by the consumers in our midst and hearing their stories of what they've overcome. And we know that in some ways they are the exception, that there are many more who did not make it out and who are still suffering poor health and poor outcomes and a poorer future. Next slide. If there's one thing I want you to take away, it is that homelessness is evil and must be destroyed. I say that homelessness is evil because it kills people. It kills people. People are dying because they are homeless, because they don't have a home, because they can't receive the medical care, because their conditions are made worse and harder to treat. Homelessness kills. Homelessness destroys health. is so much harder to stay healthy or to get healthy once you become homeless. Homelessness kills, homelessness destroys, and homelessness steals. It steals opportunities, it steals hope, it steals families being reconnected, it kills, it steals, it destroys. That to me is evil, especially when it can be prevented, when we have the tools available to prevent it. About 3 years ago, I was on an outreach, something I just do on my own, not connected with work, and with the group on a cold winter's day, and we would go and try to find people. And one of the guys on my team received a call on a cell phone, and it was his father's secretary. His father worked for the civil service and was stationed in Ghana, so his secretary was returning a call from him. They knew each other well. So he told her what she was doing. And she just laughed because she thought he was joking. He said, you know, you're saying that there are people in New York who want a house and don't have a house and are living on the streets. Stop joking. He said, no, I'm serious. And then the line just got quiet. And she said, that's really sad. He said, and it's more than sad. It's sick. It's sick. A society that can prevent homelessness doesn't. We have tools, we know what works, we know what causes it. Now we have work to do. And certainly from a public health point of view, we know that many of these tools work. We know that rent subsidies work, we know health care for the homeless works, we know prevention works, and what we can do a better job at figuring out for which people we need which particular intervention. But that's a very solvable problem. So the next and last slide is that public policy created modern homelessness, and public policy can end it. I can't take credit for this. This is what I've learned from the council. Public policy created homelessness. Public policy choices that we have made as a nation created modern homelessness. It wasn't always like this. And it doesn't always have to be like this, and it cannot be like this. It cannot. Homelessness is evil and must be destroyed. The response to evil is not to say, well, let's see what we can do about it, how can we work around it? No. For too long, we have accepted what is unacceptable, we have tolerated what is intolerable, and we must have the sense that we must and that we can end homelessness now. In Martin Luther King's book related to the events of 1963, titled Why We Can't Wait, he spoke about the fierce urgency of now. And I think that really applies to us in our fight against homelessness. There is no time other than now. It's not a matter of let's wait till next year. We may not solve it till next year or even a few years later. But we have to have the urgency that we have to try to end it now. We have to take steps now. And as we go and as you learn throughout the conference, no matter what your discipline, whether it's as a clinician, whether it's as an administrator, whether it's policy, health outreach, I ask you to also take on the lens of public health and public policy. That everything that you do, whether you're learning that you will be working to end homelessness, on a one-to-one basis with your patients or your residents in your facility, or as you're administering programs, how you can help to end homelessness for your community, but also public policy. Public policy choices that we will make. As we go visit those on the Hill, we have to emphasize to them that they can make choices, that they need to vote for bills, they need to appropriate money to solve homelessness. The public health cost, the human cost, the moral cost is just too high, and we have to let them know that it is unacceptable and we cannot bear that burden, and we won't bear that burden anymore. Thank you, and we will go and fight to end homelessness now.